Here we're going to talk about the problem of hidden attributes in the context of health insurance. So, here's something that we have to think about. Imagine hypothetically that you'll be born into a population without the knowledge of whether you will have some serious health problem, so now or later in life. So you don't know what's going to happen to you in terms of the life trajectory that you're going to have. You just don't have that knowledge. And now imagine you know nothing about who your parents might be or where you will be born. So you don't know what your health conditions are going to be, you don't know who your parents are, where you're going to be born. Okay, so knowing that, what do you think about? Would you buy health insurance if the premium, the cost of insurance to you, is sufficient to pay for the medical services required across the entire population if everyone agreed to purchase it? So think about that for a second. What do we have here? We're doing a thought experiment and we're saying, you don't know what your own health conditions are going to be. You don't know who your parents are going to be. You don't know where you're going to be born, and so on. Without knowing any of that information, you're trying to make a choice about whether or not you'll buy health insurance. So what's going on here? Well, try and answer that question for yourself. What would you do in this context? Just scribble down a note and say, oh, I would buy insurance, I wouldn't. Now, this kind of problem that we're discussing here is what's called a putting yourself behind a veil of ignorance. A veil of ignorance is when you're pretending that you have a veil in front of your face, in front of your eyes. You do not know your position in society. You don't know your background. You don't know your parents. You don't know what country you're born into. You don't know how much wealth you would have access to when you're born. You're behind a veil of ignorance. Now, this is important because it's a thought experiment in which we're trying to think about the kinds of policies that we might want to adopt in the absence of having access to this information. So, here we're trying to understand what you would do in the absence of knowing what you would do in the state, without knowing what the state of your health would be. My dog was dreaming. So, how does the situation change if you can choose whether to buy health insurance, knowing what your current health status or some aspect of your future health status might be? Maybe you know something about your genetics, maybe you know something about your parents. So let's think about how that might play out in a principal-agent relationship as follows. We have an insurance provider who is the principal. We have the potential buyers of insurance, and these are the people who would be insured. Okay, those are the agents. Now, people are more likely to buy insurance if they know they are currently ill, they have a pre-existing condition, or if they know they are likely to get ill in the future. If you know that you've got it in genes, or you know that your parents have a certain genetic predisposition, you're more likely to buy insurance as a result. Now, this information is asymmetric. You know this information about yourself, your family, and your own attributes. The insurer does not have that information to the same degree. Now, what this means is that there's an asymmetry of information between you, the person who's going to get insured or buy insurance, and the person who's going to insure you, or the company that's going to insure you. Now, insurance companies selling insurance to people, they know that those people are going to be sicker on average, and that's only going to be profitable if they can charge higher premiums to people who are ill. And that's what's higher relative to what, you might say? Higher relative to what would happen if you could somehow get everyone to buy insurance. Now, if everyone bought insurance and the risks were exposed to all people, then the price for insurance would be lower because you would have healthy people in there, unlikely to get ill, unlikely to need as much help, who are paying into the insurance program. Okay, so those people who are healthy are for sure going to subsidize people who just by chance happen to end up unhealthy for whatever reason. So, what this means that this will lead to people, that those who are reasonably certain that they are healthy, so if you know you are healthy, you might not purchase insurance. Okay, so what's going to happen here? You know you're healthy, and there are other people who know they are ill or have pre-existing conditions, and they know they want insurance. What's going to happen to the insurance market if you know you're healthy and you know that your future looks like relatively bright health-wise? Would you want to buy insurance? Well, probably not. Now, what this means is that to remain in business, the insurance company is going to have to charge even higher premiums. Why is this? They're healthier people. They don't want to pay for the insurance. They leave the insurance market. What does that do? The remaining people in the pool of people who are being insured, their average level of health is going to go down, or their average level of expected quality of health in the future. That's also going to be lower. So you're going to have to charge those people more in order to insure them. But that means that some people at the margin, again, maybe you aren't as healthy as the most healthy people, but who are still healthier than people with other pre-existing conditions, they also might not be willing to pay high prices for insurance. So they're going to exit. But then what's that going to do? That's going to again worsen the average health of people in the insurance pool. And then the premium's going to have to go up again in order for this to remain profitable. So this is another example of adverse selection like we looked at in the lemons market. And what happens as a result is that there's a problem here in terms of the market potentially unraveling and ceasing to exist. So here, what you want to think about is, what is the hidden attribute in the case of health insurance? I'm not going to answer that question. You should be able to pick this up. What is the hidden attribute that we're talking about here that produces the adverse selection problem in the case of health insurance? So here it is. The hidden attribute of health status can result in an unraveling of the healthcare market. So if insurers can't access the healthcare status of the people that they're going to insure, that could result in an unraveling of the insurance markets. Healthy people who maybe want to buy insurance because they're worried about certain risks, such as of a car accident or similar, they're going to be priced out of the market too. They don't want to pay too much for the insurance that they would want. And so in this case, you often end up with what we call a missing market, a market that could exist, but would only exist if health information was symmetrical and verifiable. Okay, so the important thing here, though, is that you might be saying, but wait, I live in a country that does have A, health insurance, and B, maybe a national healthcare system, such as the NHS in the UK, or other kinds of systems in mainland Europe, Canada, and other locations, Taiwan, for example. Now, when you're thinking about that, when we're thinking about this idea of a missing market, okay, this idea of a missing market, it is the case that in some poorer countries in the world, you don't have the same existence of national healthcare systems to the same degree, or many people are priced out of buying health insurance. And so you also have kind of partitioned healthcare systems, like a government system and a private system side by side, where some people are priced out of the private system, which maybe is higher quality or has access to better quality provision. So you can also end up with missing markets there that we might want to think about. Okay, now, under the ideal conditions of having access to the information, the market could provide benefits to both insurance company owners who want to make profits in the insurance company's context, and people who wanted to insure themselves against the risk of potential health liabilities. So not having such a market is Pareto inefficient. It would be Pareto superior to have such a market, but the lack of it is Pareto inefficient. So incomplete contracting, hidden attributes, and the resulting problems of adverse selection, the result is a Pareto inefficient outcome. We would much rather be in a situation of symmetric and verifiable information where we could feasibly find out that information and provide insurance to people. And the question is, what kinds of policies could address the problem of adverse selection due to asymmetric information, and also the resulting missing markets for health insurance? So all kinds of things that we can think about here, but one is something like a national healthcare service where everyone has to pay. There, you're kind of forced by the tax authorities to pay, or the social insurance authorities to provide payment into the system if all citizens of a country pay into that system, such as in the NHS in the UK. In other systems, you have structures where, again, there's taxes on what you pay at your job, and the taxes at that point provide payment for healthcare provision. So these are kinds of ways that we can think about for solving this, because everyone pays into that system and thereby gets access to healthcare, and that ensures that the market does not unravel.